their low glycemic index. It was reported that serum reduction on average of 40% in obese patients with total caloric deprivation undergoing fasting for periods of 4 to 8 weeks, although vital studies are required to better clarify the underlying role of diet in social beyond physiology. The authors co-exhibit a supportive effect of diet management in the treatment of enlarged facial growth through lowering of serum secretion. Second was improving skin elasticity. We did it by sun protection, carotenoids, and 2,790 Caribbean yet has fewer complications and is effective in the improvement of scars, holes, wrinkles, skin tone, and plaque. 1,400 gam fractional Caribbean fiber laser is effective and safe for treatment of the laser facial growth in skin type 3 to 4.
Review new paradigm in pathophysiology of acne, new treatments that I've curated for you that have very interesting aspects that are of value potentially to you in your acne patient care, new ways of using our current treatments, and then new ways to inform patients to engage in mature decision-making for acne. The objectives are to discuss the role of sebum in acne, evaluate the mechanism of action of topical ascorbate, and ask you how sarecycline is different from the standard other hypercyclines in this class in terms of structure, and then as a proxy, the difference in global success when a treatment is used for 24 weeks rather than the standard 12 weeks in clinical trials, and then discuss the patient decision-making for acne that you use for your patients. There's been a new paradigm in pathogenesis of acne where we no longer just focus on C. acnes, but actually focus.
Also, it's a question about how much muscle masses do you have. So if you have significant larger amount of skeletal muscles, like in the male patients, then you have to use more toxins, and also for the stronger movements, you have to use more toxins than in the female muscles. So never forget, keep the emoticons. If you keep the emotion and don't tox too much the patients, then you will have seominicons which are happy with your outcome. So thank you for the first part of the session. The one which are shown here is because of the vascular supply of the face, as you see in this network here, and the others might be, of course, swelling and other things which might be a problem. But the most dangerous thing is, of course, the vascular embolism of after the injections, and therefore it's important to have also your hyaluronidase in the fridge, but we could talk for hours about this. Let's go to the anatomy then, and this is a picture from Professor. You will notice it's about the layers, and if you have to think about layer-wise treatments of the face with different kinds of fillers, and therefore it's also very important to think about the rheology. So you have the skin, you have the subcutaneous structures, the muscular aponeurotic system. Then it's almost all those things about elasticity, cohesivity, viscosity, about the cross-linking technique, purity, biodegradation, etc., which makes the perfect filler for your treatment. This is the range of commercial products. So we have everything in our hands, like the fillers, the HA fillers for the plasticity, the volume. Then you have the intense with the higher elasticity. You have the working horse.
And as when you go in, you push your cannula and you just push gently and twist it around. Okay, and you push all the way in. And then you start to inject in a retrograde fashion, and the first time, then retrograde. And you would go back and forth. Even when you use a cannula, if you try and aim to be under the more obvious stretch mark, that would be great. But obviously it's not easy when using cannula, and that's why we do the needle later on. But we do as much as you can. Then we do another entry point. Okay, and I always do the anesthesia for multiple entry point, because when I start, sometimes I might change the entry point I started with. So for example, for this patient, we put a little bit of light in this one area, this one, and this one, another two to the side.
I see that you are becoming bigger and bigger and stronger, and I congratulate all of you for that, and also congratulations to the doctors, to all the doctors that will be awarded later for their efforts in the medical field. I have in my family also a doctor, my brother, 1 year older than me. I mean, I've lived so many years with him. He is also an orthopedic surgeon, specialist a spine surgeon. And I have also a daughter, not a daughter, a sister who is a pharmacist. Well, I have been only 2 months here. I have just arrived. I am very happy, very much impressed by your kindness and your generosity. This is a wonderful country. I think this is the place to be and the moment to be, the right moment.